Virtual reality sickness, often called VR sickness, is a form of motion sickness experienced by users when they wear VR headsets. It happens because your eyes perceive movement in the virtual world, but your body remains still, causing a mismatch in sensory signals. This can lead to symptoms like dizziness, nausea, headaches, and general discomfort. Understanding the basics of VR sickness is the first step in learning how to manage and prevent it. In this video, we'll explore practical strategies to help you enjoy VR experiences without feeling unwell. VR sickness can manifest in several ways. The most common symptoms include dizziness, nausea, headaches, sweating, and a feeling of disorientation. Some users may also experience eye strain or fatigue after prolonged use. Recognizing these symptoms early is important, as it allows you to take action before the discomfort becomes severe. If you notice any of these signs while using a VR headset, it's best to pause your session and follow the tips we'll discuss next. VR sickness occurs due to a conflict between what your eyes see and what your inner ear senses. In VR, your vision tells your brain you are moving, but your body feels stationary. This sensory mismatch confuses your brain, triggering symptoms similar to traditional motion sickness. The severity can vary depending on the VR content, headset quality, and individual sensitivity. Understanding this mechanism helps you realize why certain games or experiences might make you feel worse than others. One of the simplest ways to reduce VR sickness is to take regular breaks. Limit your VR sessions to 15-30 minutes at a time, especially if you're new to VR or prone to motion sickness. Step away from the headset, stretch, and allow your senses to recalibrate. Frequent breaks can help prevent symptoms from escalating and make your overall experience more enjoyable. Over time, you may find your tolerance improves with consistent, short sessions. If you're sensitive to VR sickness, start with less intense experiences and gradually increase your exposure. Begin with stationary or slow-moving VR content, then slowly progress to more dynamic environments. This gradual adaptation allows your brain and body to adjust to the sensory input, reducing the likelihood of discomfort. Over time, you'll build up a tolerance and be able to enjoy more immersive VR sessions without feeling sick. A poorly fitted headset can worsen VR sickness. Make sure your VR headset is adjusted properly, sitting comfortably and securely on your head. Adjust the straps and lenses to ensure clear vision and minimal pressure. A good fit reduces eye strain and prevents unnecessary movement, which can help minimize symptoms. If your headset feels uncomfortable, take it off and readjust before continuing your session. Many VR headsets allow you to adjust visual settings such as brightness, contrast, and field of view. Lowering brightness and increasing contrast can reduce eye strain. Some headsets also let you change the field of view or motion blur, which can help reduce the intensity of visual motion. Experiment with these settings to find what works best for you, as small adjustments can make a big difference in comfort. Some VR applications include built-in anti-sickness features, such as teleportation movement, snap turning, or vignetting. These options are designed to reduce the sensory conflict that causes VR sickness. Teleportation allows you to move instantly from one place to another, avoiding continuous motion. Snap turning replaces smooth rotation with quick, discrete turns. Vignetting darkens the edges of your view during movement, helping your brain process the experience more comfortably. Dehydration can make VR sickness worse. Make sure to drink plenty of water before and during your VR sessions. Staying hydrated helps your body cope with the stress of sensory conflict and can reduce symptoms like headaches and fatigue. Avoid consuming caffeine or alcohol before using VR, as these can increase dehydration and make you more susceptible to discomfort. Heavy meals can contribute to nausea during VR sessions. Try to eat light, easily digestible foods before using your headset. Avoid greasy or spicy foods, as these can make you feel worse if you start to experience motion sickness. A light snack can help stabilize your blood sugar and keep you feeling comfortable throughout your VR experience. A hot, stuffy environment can make VR sickness worse. Make sure your play area is well ventilated and cool. Use a fan or open a window to keep air flowing. Cooler temperatures help reduce sweating and discomfort, making it easier to focus on your VR experience. If you start to feel overheated, take a break and cool down before resuming your session. When you start to feel dizzy or nauseous, try focusing your gaze on a fixed point in the virtual environment. This technique helps your brain stabilize the sensory input and can reduce feelings of motion sickness. Many VR games include stationary objects or markers you can use for this purpose. Practicing this habit can make your sessions more comfortable and enjoyable. Fast or sudden movements in VR can trigger symptoms of motion sickness. Try to move slowly and smoothly within the virtual environment. Avoid games or experiences that require quick turns or jumps, especially if you're prone to VR sickness. Gradually increasing your movement speed as you build tolerance can help you enjoy more dynamic content without discomfort. Some VR users find that having a fan blowing gently on their face helps reduce symptoms of VR sickness. The sensation of airflow can trick your brain into feeling more grounded and less disoriented. Place a fan nearby during your VR sessions and adjust the speed to your comfort level. This simple trick can make a noticeable difference in how you feel. Ginger is a natural remedy for motion sickness and may help with VR sickness as well. You can try ginger tea, ginger candies, or supplements before your VR session. Ginger works by calming your stomach and reducing nausea. While it's not a guaranteed solution, many users find it helpful for managing mild symptoms. Deep breathing exercises can help calm your nervous system and reduce symptoms of VR sickness. If you start to feel uncomfortable, pause your session and take slow, deep breaths. Focus on inhaling through your nose and exhaling through your mouth. This technique helps lower anxiety and can make it easier to return to your VR experience feeling refreshed. Maintaining good posture while using VR can help reduce symptoms. Sit or stand upright, keeping your neck and back aligned. Avoid slouching or twisting your body, as this can increase discomfort. Proper posture supports your balance and makes it easier for your brain to process sensory input. If you feel strain, take a break and adjust your position. Proper room lighting can help reduce eye strain and discomfort during VR sessions. Avoid playing in complete darkness or overly bright environments. Soft, ambient lighting is best, as it helps your eyes adjust and reduces fatigue. If you notice your eyes getting tired, take a break and rest before continuing. Spending too much time in VR can increase your risk of VR sickness. Set limits for your sessions and avoid marathon gaming. Listen to your body and stop if you start to feel unwell. Overuse can lead to lingering symptoms, so it's important to pace yourself and prioritize your health. Comfortable accessories, such as padded straps or face cushions, can make VR sessions more enjoyable and reduce discomfort. Choose accessories that fit well and don't cause pressure points. If you wear glasses, look for VR headsets with adjustable frames or lens inserts. The right accessories can help you stay comfortable and focused during your experience. Manufacturers often release firmware updates to improve VR headset performance and reduce motion sickness. Check for updates regularly and install them as needed. Updated firmware can fix bugs, enhance tracking, and optimize visual settings, all of which contribute to a smoother and more comfortable VR experience. Not all VR content is created equal. High-quality games and experiences are designed with comfort in mind, using smooth motion and anti-sickness features. Choose content from reputable developers and avoid poorly optimized apps, which can increase your risk of VR sickness. Reading reviews and recommendations can help you find the best options for your needs. If you experience severe or persistent symptoms of VR sickness, consult a healthcare professional. Some individuals may have underlying conditions that make them more susceptible to motion sickness. A doctor can provide personalized advice and recommend treatments or medications if necessary. Your health and safety should always come first. Children may be more sensitive to VR sickness due to their developing sensory systems. Limit VR sessions for kids and monitor their reactions closely. Choose age-appropriate content and encourage frequent breaks. If a child complains of discomfort, stop the session immediately and provide support. Ensuring a safe and comfortable experience is especially important for younger users. Older adults may also be at higher risk for VR sickness, especially if they have balance or vision issues. Encourage gentle, stationary experiences and avoid intense motion. Monitor symptoms and provide assistance if needed. With proper precautions, older adults can enjoy VR safely and comfortably. If you wear glasses, VR headsets can sometimes cause additional discomfort. Look for headsets with adjustable frames or lens inserts. Make sure your glasses fit comfortably inside the headset and don't press against your face. Proper adjustment can help reduce eye strain and make your VR sessions more enjoyable. Some over-the-counter medications, such as motion sickness pills, may help reduce symptoms of VR sickness. Consult your doctor before using any medication, especially if you have other health conditions. Medications can be useful for occasional sessions, but it's best to rely on behavioral strategies for regular use. Pregnant individuals may be more sensitive to motion sickness, including VR sickness. Consult your healthcare provider before using VR during pregnancy. If you experience symptoms, stop immediately and rest. Prioritizing comfort and safety is essential during this time. VR developers are increasingly focused on accessibility, offering features to help users with different needs. Look for accessibility options such as customizable controls, anti-sickness modes, and visual aids. These features can make VR more comfortable for everyone, including those with disabilities or sensitivities. VR sickness is a common challenge, but with the right strategies, you can minimize discomfort and enjoy immersive experiences. Remember to take frequent breaks, adjust your headset and settings, stay hydrated, and listen to your body. If symptoms persist, consult a healthcare professional. By following these tips, you'll be better prepared to make the most of your VR adventures.